Patricia left that appointment with a clean bill of health, blood pressure normal, cholesterol within range, heart rhythm regular. She drove home thinking she was fine. She was not fine. And for the next 14 months, she would keep going back to that appointment in her mind, not because the doctor had lied, but because normal and fine are not always the same thing. I want you to think about your last checkup. The numbers came back, your doctor reviewed them, maybe nodded, maybe said, "Everything looks good," and you left feeling reassured. Now I want to ask you something that most doctors never ask and most patients never think to answer. Did your legs agree? Because here is something the medical system is not designed to tell you in a standard 15-minute appointment. Blood pressure measured at your arm tells one story, and blood pressure experienced by the vessels in your lower legs can be telling a completely different one. The same reading, the same numbers, two completely different realities happening simultaneously inside the same body. And the gap between them, the space between what the cuff shows and what your legs are actually experiencing, is where some of the most significant and most preventable vascular damage quietly accumulates, year after year, appointment after appointment. Normal results on paper, a different story written in the tissue of your legs. What you clicked on today is true. Her doctor said she was fine, and her legs knew something he missed. Stay with me. Patricia is 67 years old. She lives in Tennessee. And she had been going to the same doctor for 12 years. A good doctor, thorough, attentive, the kind who remembers details about your life from one appointment to the next. She trusted him completely, and she had reason to. Her checkups were always reassuring. Blood pressure consistently in the normal range. No red flags, no concerns. "Patricia, you're doing great," he would say, and she would believe him because the numbers said so. But for 2 years before the appointment that changed everything, Patricia had been noticing something she never mentioned in those 12-minute checkups, her legs. Not dramatic symptoms she might have associated with something worth reporting, nothing sharp. Nothing sudden, just a persistent, low-grade wrongness she had learned to live with. Her left leg would ache after walking 2 blocks, not unbearably, just enough to slow her down, enough to make her choose the closer parking spot, enough to make her think twice before agreeing to a long walk with her grandchildren. Her right foot, sometimes numb, not always, not predictably. Just occasionally after sitting, a tingling that took longer to resolve than it used to. She attributed it to her back, to sitting too long, to the shoes she'd worn for years. She never connected it to her blood pressure, because her blood pressure was fine. The doctor said so. Until the afternoon, Patricia's daughter, a physician's assistant, came to visit for a long weekend. They were walking through the neighborhood after dinner when Patricia slowed, imperceptibly, she thought, and reached for a fence post. Her daughter noticed, not the reaching, but the way Patricia had slowed before she reached, the calculation, the brief practiced assessment of how far the next bench was. That night, after Patricia had gone to bed, her daughter sat at the kitchen table and thought about what she had seen and what 14 months of "your mother is fine" had quietly missed. Here is the gap that Patricia's checkups were missing, something even experienced physicians frequently underestimate in standard practice. When blood pressure is measured at the arm, at the brachial artery, it gives a systemic reading, a general picture of the pressure the heart generates to push blood through the body. But pressure is not uniform throughout the vascular system. In a body where arterial stiffness has begun, where vessels have lost some elasticity, the pressure experienced by arteries in the lower extremities can be significantly higher than what registers at the arm, and simultaneously, the flow reaching those extremities can be significantly lower. Stop, because this is the paradox that most people never hear explained. Higher local pressure inside the vessel walls, damage accumulating. Lower blood flow reaching the leg tissue, muscles receiving less than they need. Both happening at once, neither showing up in a standard arm cuff reading. There is a test for this. It's called the ankle-brachial index, the ABI. It compares blood pressure at the ankle to blood pressure at the arm, and a normal ratio is 1.0 or above. Below 0. 9 indicates peripheral arterial disease, reduced blood flow to the lower extremities. It takes 10 minutes, and it is not part of a standard checkup. A 2021 review published in the Journal of the American Heart Association found that peripheral arterial disease, detectable by ABI testing, was present in approximately 1 in 5 adults over 60 with otherwise normal cardiovascular risk profiles, normal blood pressure, normal cholesterol, doctors who said they were fine. 1 in 5. Patricia was one of them, and the test that would have shown it had never been ordered because nothing in her numbers had ever suggested the need. Patricia's daughter made the call at 7 in the morning, not to Patricia's doctor, not yet, but to a vascular specialist she knew professionally. "I need a favor," she said. "An ABI on my mother, normal pressures, normal everything. But she's slowing down on walks and she doesn't know she's doing it." The specialist said, "Bring her in." Patricia was resistant. "My doctor just checked everything. Everything is fine." And her daughter said, "Mom, your doctor checked what a standard checkup checks. I want to check something different. Something different." The ABI results were unambiguous. Patricia's ankle-brachial index, 0.78, below the threshold for peripheral arterial disease, meaning the blood reaching her lower legs was measurably, clinically insufficient. The specialist looked at the results, then at Patricia. "How long have you been slowing down on walks?" "About 2 years, maybe longer." "And your legs ache when you push past a certain distance?" "Yes, but my blood pressure is normal, so I thought." "Your blood pressure at your arm is normal," he said carefully. "What's happening in your leg arteries is a different conversation." Patricia sat with that for a moment. 2 years of slowing down. 2 years of chosen parking spots and shorter walks, and calculations about benches, and a number, 0. 78. That 12 years of checkups had never looked for. 4 targeted interventions addressing the specific mechanisms the ABI had revealed. The first was supervised walking, and this surprised Patricia most because her instinct had been to rest when her legs ached. The vascular specialist said the opposite. The aching is your muscles asking for more blood than your arteries are currently delivering. The way to improve delivery is to consistently demand it. Walking to the point of mild aching, then stopping, then continuing, is the most evidence-based intervention for peripheral arterial disease. It triggers the growth of collateral vessels, new circulatory pathways developing alongside the compromised ones, new routes for blood when the original routes narrow. Patricia walked every morning 15 minutes to the ache, rest, continue, and by week 6, the distance before the ache had increased measurably. The second was magnesium daily. Magnesium is essential for arterial wall relaxation, the ability of vessels to dilate in response to blood flow demand, and without it, Arterial walls remain chronically constricted. Patricia added 300 milligrams of magnesium glycinate with her evening meal, and within 3 weeks, the foot numbness had reduced significantly. The third was nitrate-rich foods daily: beets, leafy greens, arugula. Foods high in dietary nitrates the body converts to nitric oxide, the compound that signals arterial walls to relax and expand. Half a cup of beets or a handful of arugula at lunch every day, directly targeting the endothelial dysfunction restricting flow to her lower legs. The fourth was her doctor, informed, not replaced. Patricia brought her ABI results to her regular appointment, and her doctor reviewed them carefully. "I should have ordered this," he said. "I'm glad it was done." He added the ABI to her annual protocol, referred her to the vascular specialist for ongoing monitoring, and adjusted her care plan to address what had been there all along, invisible to standard measurements, but present in every slow walk and every reached-for fence post for 2 years. 4 things starting today. Ask about the AB at your next appointment. Has anyone checked my ankle-brachial index? A 10-minute test that could reveal what standard tests miss, and you have the right to ask. Walk to the ache, not away from it. Mild leg discomfort during walking is a demand signal. Ask your arteries consistently, they respond. Magnesium glycinate, 300 milligrams with your evening meal. Talk to your doctor first, but understand what it does. It relaxes arterial walls and addresses one of the most overlooked drivers of peripheral vascular restriction. And nitrate-rich foods daily: beets, leafy greens, arugula at lunch, the raw material your endothelial cells need to produce the nitric oxide that opens the vessels your legs depend on. Patricia told me something about the appointment where she showed her doctor the ABI results. She said, "He looked at the number, 0.78, and said, 'I should have ordered this.' And I sat there thinking, 12 years. 12 years of appointments, 12 years of normal, and what was actually happening in my legs was never on any of those papers. 12 years of being told she was fine, while her legs were telling a different story. Every slow walk, every fence post, every grandchild who ran ahead while Patricia calculated the distance to the next bench. Her body was never lying. Her measurements were never complete. Normal results are not a complete picture. They are the picture that standard tests take, and standard tests do not see everything. Your legs live in your body every hour of every day, and if they are telling you something different from what the paper says, both things can be true simultaneously: the paper and the legs, the number and the experience. Listen to both. If Patricia's story felt like something you've been carrying, the normal results that don't match what you feel, the slowdowns you've explained away, the trust placed in numbers that weren't measuring the right things, don't scroll away. Leave a comment, 2 or 3 words. Tell me what your results don't show. Because someone will read those words today who has been holding the same quiet contradiction, fine on paper, something else entirely in their legs. Hit the like button if Patricia's story reached you, and subscribe to Strong Legs. Independent Life, every Tuesday and Saturday at 11 a.m. Because normal isn't always the whole story, and your legs deserve the whole story. Keep smiling, keep moving, and never forget, you've got this.